there an AI topic that is not getting enough attention right now?
I have a few, but
Yeah.
but I'll stick with one. I think really as I started to say, the AI tools that make physicians in small to mid-sized practices, their workflows more efficient, their lives easier, and allow them to provide better healthcare. Not taking over what they're doing and documenting their clinical care, but doing things that support them and streamline those processes.
An AI topic that really needs more focus, attention, and effort is around the area of responsible AI. So really thinking about how do we actually deploy AI effectively and responsibly and do so in a way that is equitable. It's a complicated problem that really needs more investment, time, and attention to ensure that we're actually driving improvements for both patients and clinicians.
So lots of lip service as to how AI is going to get implemented across companies, and we are certainly deploying AI and have been for things like clinical decision support and to help providers improve their workflows. I think what is not getting discussed as much is this idea of development of AI versus implementation and management of AI. AI is very much a process, not a single product. And so I think when we see how these products are going to be implemented and then managed with human oversight, that is where we'll see the difference between success and failure.
I think one of the crucial burden on the physician is summarization of information that's out there at different sources. I don't think sufficient focus is being placed upon how to leverage AI to summarize data from different disparate sources, like unstructured data, structured data, scanned documents, and that's where we are focusing on.
So I'm a physician by training, and my company specializes in diabetes and chronic care conditions. And I would say that one of the things that's very frustrating is not just disease prevention, but also slowing down disease progression. And one thing I would love to see happen is developing AI tools that incorporate a lot of disparate data, including the medical device data that we get, for instance, from CGMs, but then tying in social determinants of health data. Social, just zip code, income, like all these other things that factor into the lives of these individuals living with diabetes. I think it would be really great to have predictive analytic tools to help guide management of these patients better.
Yeah, so AI is everywhere, as we know. It's on every booth pretty much here at ViVE, and likely, will continue that way. But what we really want to highlight about AI is getting access to the right data. So without good, clean data and getting access to that data, it's going to be pretty difficult to use AI or ML. So making sure that that access is available is one of the key things that Commonwealth does in breaking down those silos to interoperability.
Yes, doing less in terms of AI, but doing it at scale. So when we talk about being able to solve a practical problem with AI, like taking cost out of the health system, or being able to avoid somebody having to type a health record 2 and 3 times, being able to focus on that and then do it at scale, doing it 100,000 times a day, doing it 1,000,000 times a day, so that you're solving a smaller problem, but you're doing it at a much larger scale. So it's the scalability and practicality that aren't being talked about that really needs to be reinforced and talked about. That's what customers care about.
Yeah, absolutely. So at Duos, we're actually part of the OpenAI startup program, and we use their large language model for matching between the really diverse inputs that we get from older adults, from caregivers, from our own staff, against this massive database of resources that we've built in terms of Medicare Advantage benefits, state, federal, and VA programs. And so one of the things that we don't think gets talked about enough is the amazing potential of artificial intelligence relative to increasing the accessibility and the access to all these programs and benefits that have been out there. And we look at that in a couple of different ways. One is these large language models are amazing at understanding languages. So, the final mile of actually being able to converse has been really hard as you're dealing with an aging population that is growing faster than it ever has and is more diverse than it's ever been. And these large language models are incredible at being able to handle that and therefore increasing the accessibility for those users relative to the resources that are available to them. And then second, they do an incredible job at going from that need to the actual proper blend of a Medicare Advantage benefit and government program. We train it on our side so that we can do the right sequencing. And so we think that access and basically the accessibility and that access increase doesn't get talked enough about in AI, because so often in healthcare you hear about people using AI to deny claims or deny a prior authorization. And it's all about the negative, dark side of it. And we look at it as this incredible enabler to, again, increase that access and accessibility for these older adults that really need help getting these services that help them age healthier on a day-to-day basis.
The topic we're not talking enough about is how to manage a portfolio of algorithms rather than just one.
Absolutely. And that's the AI literacy of the healthcare workforce. Everybody assumes that if you build it, they will come and they're going to start using it naturally, and that's not happening today. So I think if you want to really move healthcare forward, you have to put AI in the hands of clinicians, nurses, and all members of the care team, and get them to start thinking differently about how they redesign their workflows, their pathways, and how they integrate this kind of information into their decision-making process. It's a big process that I think has to start today. And if we don't do that, I think there's too much focus on the technology and not enough focus on what clinicians need to do to really transform their practice and their integration of this information to deliver better care for patients.
One of the issues we're not talking enough about is the impact of diversity and inclusion within the healthcare ecosystem, specifically the pendulum swinging back far to the left and starting to marginalize our commitment to diversity and inclusion.
I think if you consider AI and an ability to attach real-time indoor tracking data, you have an ability to do a real-time monitoring of patient flow, resource and staff movement throughout your facility, and understand where the pinch points of patient throughput are and resource utilization within your organization. And so we're targeting the technology combined with AI to address those issues, enabling nurses to be more efficient and increase their bedside time, as well as overall patient care time spent.
It's hard to say that there's any AI topic that's not getting a lot of attention the last couple of days.
True.
But I think one of the common refrains you hear on AI is that the models are only as good as the data that you put into it, which is true. But I think one thing that we may not be valuing enough is the role of AI in actually cleaning, structuring, normalizing, and standardizing data. I think we got it wrong when we did EHR implementations. We digitized the traditional chart, but we still have lots of unstructured, non-standard data out there. And we know a lot about what it looks like to create structured standard data out of that, because we've been training people, chart abstractors, whole businesses, companies, solutions built around this. So we have a lot of information on how to train these models to help make that process a lot more efficient and effective. So I think that's our first use case, is point AI at our data problem, where we can do it in a controlled way, in a consistent way, where we can systematically analyze data quality and build a whole lot of value for ourselves, again, across lots of use cases.
Well, me being a nurse, I might be a little biased, but from what I've seen, the AI use cases that support nurses, that's not being addressed. Physicians and all the latest and greatest, I would call it the fun stuff. Everyone's talking about that, but not the low-hanging fruit is what I would refer to. So what can help ease the burden on nurses? Ambient listening, digital scribe, helping ease the burden of documentation. That's not really getting enough attention, I don't think.
Yeah, so I actually started in a different industry than healthcare. I actually started it in financial information technology. So I've been dealing with, I'd say, the promise of AI really for 30 years now in my career. I designed products for quants back in the late 90s. And I think the part that I think is undersold, and I think is incredibly important for people to understand, is when we're talking about the technical underpinnings to really get the results and the benefits out of AI, whether it's generative AI or whether it's just using AI from a technology stack perspective, is really understanding getting your foundation right, getting your data normalized, using and leveraging standards where necessary. And I think that, like all things that are sort of new and shiny, that underpinning in the conversation really is being not taken as seriously. And I think you'll have many disappointed purchasers when they realize that garbage in equals garbage out, but it'll at least get people on the learning curve.
Yeah, I think if you look in the headlines, you see things like GLP-1s and Taylor Swift and of course AI, right? So AI is a really big topic. At Prescriptive, we bring AI technology to pharmacy, which I think is very underutilized. So we did a survey, and we noted that 54% of pharmacists spend more time this year, last year, I guess, when we did the survey in 2023 than 2022, looking up cash pricing for patients. So what we did is we developed an AI system that allows pharmacies to actually take their cash price and put it at the right location where they make enough profit, but don't overprice it so it pushes customers and patients away, so that they can actually have a profitable cash solution without breaking their bank. There are competitors in our space in this cash space that charge quite high administrative fees, and we do a very low administrative fee to provide a service. And it's not really a cash discount program. It's actually a really intelligent thing that changes, and even daily will change based on market conditions for the pharmacies to keep them profitable.
So I think there's a lot around governance of AI. Is it, concerns bias in the systems and other ways that AI is being used. One of the topics that I've been thinking about is how are health systems needing to staff the teams that will monitor these AI solutions and really be looking at the behavior and where concerns arise and how to iterate on the model. And is that for the vendor? Is that for the health system? Is it on both? And who is that's going to need to be hired for those types of positions?
Oh my gosh, AI is everywhere, right? As we know. I think the one that isn't getting enough attention is relevant, validated assurances over AI. There's a lot of standards that are out there, but most of them just hit the wave tops. So what's really important, whether we're implementing AI internally as a healthcare organization, or more importantly, if we're leveraging a third party or a vendor that's focused on AI, we need to make sure we have validated assurances in place that are independent and objective assessments in order for us to rely upon those from a modeling perspective.
I want our conversations around AI to be much more intentional and explicit about the problem that we're trying to solve. So what is it that we are trying to solve through AI? Why do we think that AI is the optimal solution to solve that problem? And then most importantly, how are we going to define and measure success? There's lots of potential opportunities and promise with AI, but it's also not without peril. We know, for example, that algorithmic bias is very evident in its ability to create, perpetuate, or exacerbate inequities in care. So if we are not careful, if we do not think about this with intention and being explicit about that and measuring, we have the potential, unfortunately, to do a lot more harm as it comes to health equity.
There are a lot, but I have to sort of let the misinformation problem sort of rise to the top of that. It's certainly that there's a lot of attention being given to misinformation, but the magnitude of what it could potentially turn into, I think, deserves a bit more attention. I think there's two converging themes which are happening. One is that the large language models have enabled groups of actors, in some cases bad actors, to populate with lots of information which can be false. And that's now being picked up in traditional ways by major search engines. So are populating to searches as people are searching for health information, as they always do, which may more likely to be false or misleading. And the other side of it is the large language models themselves, as people are starting to turn towards that environment to get information. The information there is presented coherently, it's compelling, but it's even harder to tell that it's false there. So I think those two converging themes are going to potentially make the misinformation problem much worse.
Great question. I mean, AI topics are kind of all over the place today, and I think entrepreneurs are looking under every nook and cranny. I think for me, what I said in the revenue cycle space, one particular theme around admin efficiency is an area of opportunity that more attention could be focused on. Payer-provider contracting right now is very messy and uses clunky, outdated technologies. And I think AI could come in and really clean things up, make it easier to manage these contracts, organize them, and eventually make it easier to have payers and providers contract more efficiently.
I certainly think there is. Beyond the scope of documentation and scripting at a clinical level, one of the biggest and most frustrating challenges that health systems face today is that of administratively orchestrating staff to serve patients in need. For us, we see a massive window coming where in the next short period, we're going to witness AI at work solving problems there as well.
Awesome. Thanks, Curtis.
You bet. Thanks, John.